And that's a proper t-shirt. I'm keeping mine for Friday.
Dig mine out, I think. Saturday here.
Hello, how are you?
Hey.
Sanjay, the man.
Hello.
Hey.
Hello.
Sanjay.
Good afternoon.
Hello.
Hi.
Hello.
Wow, it's amazing to
Anara.
see so many people.
Hi, Svetlana.
What?
I'm glad to meet you
Professor.
again.
Yeah.
Oh, super.
We've also got Dr. U on the call.
Hi.
Hi. How,
Hello.
It's,
Hello,
it's a
Sanjay.
very international meeting.
yeah, he's joining us
Yeah.
from Myanmar.
Oh, fantastic.
Yeah. Okay. Very nice to meet you.
Yeah.
Hello from Myanmar.
Yeah.
Nice to meet you.
So
How are
this-
you?
Doing okay. Yeah.
Yes, I'm so far okay. Yes. So far.
Yes.
Munize, we are following your lead.
Yes, I know. I think the best thing is we probably wait a couple more minutes. I think Ed and Nini and a few others will join as well. And then we can sort of start. And so the format for today would be, I'll do a presentation. We'll focus on our work in Myanmar first. And we've got a few questions with Nini and Ed. And Sanjay, if he wants to chip in. And then we'll focus on our work in Kyrgyzstan and talk to Renisa, who's on the call, but also having Anara and Svetlana on the call. And then, yeah. Great. So I'll give it like another few minutes and then we'll begin. Great. I think we'll start and then people can join. So here we go. Wait. Sorry. Having a slight technical issue here. I don't know why. So I'll start again. That's better. Great. So we're on day 2 of our live sessions today, and hopefully you all can hear me. So today we're going to focus more on our healthcare work and kind of introduce you to the program. Many of you are new to it, but I think a lot of you are very much part of it and have kind of gone through it or been involved in it. So this will be a nice summary for all of you. So our work in healthcare is really to support needing populations through medical assistance, whether it is the transfer of knowledge or at times provision of medicine. And we have our sort of, here's a outcome mapping, a planning document, or rather strategy that we had at the beginning. We focus on 4 different tools. One of them is workshops, medical missions, and fellowships, which are going to be the key things that we discuss today or introduce you to. Everybody on the call has either been to a workshop, taken part in it, been on a mission, or been on a fellowship. The aim here is to improve the knowledge of doctors, improve the kind of way a clinic is run, and sort of make sure that patients coming from low income settings can get the treatment that they need. The illnesses we focus on are infectious diseases, HIV, TB, AIDS. In the beginning, we focused mostly on HIV, and then gradually it became TB and also any comorbidities that come with it. So, so where do we operate? So this is quite an international call. We have people from Myanmar, we have people from Kyrgyzstan, and that's really where we work. We've also done a few projects in Vietnam in the past, and this was sort of a short-term intervention that will also be introduced in this call. But mostly we focused on Myanmar and Kyrgyzstan, and that's really where we are putting all our efforts as well. So, and our supporters, it's also quite wide-ranging. We've got great support from pharmaceuticals, and we hope to continue that, but also lots of trusts and healthcare organizations that have contributed either pro bono. So Ashfield Healthcare Communications will always provide us with conference passes for our visitors for fellowships, but then other people will provide funds to support volunteers in either country, mostly Myanmar. So our partners in the UK, we're lucky to really partner with the British HIV Association. They're a leading professional UK association. They provide us with volunteers. They've funded speakers to go to Myanmar, and they provide us with guidance and knowledge on sort of not just guidelines to introduce in clinics, but then also key kind of individuals that can really bring a skill set for our countries. And the other one is the Royal Free Hospital that has been hosting our preceptors or our fellowship doctors for the past, I would say, 3-4 years. The doctors enjoy doing day-to-day activities with clinicians within the hospitals. And I think it's been such a wonderful experience for a lot of people on the call, and they will share that with you later on. So in Myanmar, we'll just, our partner is Medical Action Myanmar. They've been established for almost about 12 years, but before that, they used to be Medicines Sans Frontiers set up. It just became a local outfit to continue running these 7 clinics that are really providing for people from low-income settings. Currently, the townships that they operate in are also the ones that have been affected the most by political unrest. So hopefully Nini is later on the call, depending on if she has Wi-Fi, and she can give us a little bit more of how they are coping with that. The other people that we work closely with in Myanmar is the Ministry of Health. We have Dr. Wu here on the call, and he's somebody that has helped us with the delivery of these workshops, getting us to have doctors coming from government hospitals, but also getting all the clearances and all the approvals that are needed to make these events happen. So firstly, the volunteering missions. These are doctors from the UK that will go and be in Myanmar for up to 5 months. They give up a lot of their time. They're probably taking a sabbatical, and they really do a day-to-day training and sort of guidance for doctors. We started out with doctors, but then moved on to nurses and then also pharmacists. And they've done a range of activities, and later on in this presentation, they share some of them with you. The other thing that we've been doing is fellowships with Medical Action Myanmar clinicians. These are mostly doctors that are sort of 3-4 years into their career, and they come for 2 weeks to now almost a month, and they'll be doing ward rounds and sort of taking part in day-to-day running of the clinics. And then finally, which is the workshops. This is an annual event that has been taking place since 2015. Planning usually takes about 6 months for each event, because you're sort of having 70 people coming to a hotel, catering, everything, presentations is all being organized, and they're intensive days, full on. And we've been doing them in the medical field for HIV since 2015, and then soon, very recently, we've also started working in TB, and we've sort of tailored that towards Myanmar because it is an area of concern there. Our partners were quite interested in bringing this learning. Most TB patients are treated at government hospitals, so it's a great way to forge links within government institutions and make sure that, you know, the delivery and coverage of treatment is equal all around, be it NGO hospitals or government hospitals. So now we have a few messages from our participants, so I'll let you listen to those.
Hello everyone, my name is Gonzali. I'm really sorry to join the session. I work with mom from.
You need to increase the volume.
Yeah, you might have to increase volumes on your side if the sound is low, sorry. I can't place that. Ah.
Hello everyone, my name is Tanzani. I'm really sorry I didn't join that session. I worked in Myanmar from 2014 to 2017. In 2016, I got an opportunity to visit London and do Greenshot funded fellowship program, and I did do attachment in Library Hospital for 2 weeks, and also attend the conference, HIV conference in Glasgow. With Dr. Sanjay in Library Hospital, I would say that was really a good experience that opened my mind and eyes and got a lot of experience. For example, Dr. Sanjay showed me how to use fibroscan. That was my first time seeing that, and I found it really helpful and handy to use in clinic setting. So when I went back, I discussed with me, and we could set up a hepatitis C program, and we could buy the fibroscan funding, and we started with 100 hepatitis C positive patients. So that was really helpful. Another example is I observed that there is less advanced nurse practitioner lab clinics in Library Hospital. Before that, I didn't realize that nurses can also do follow-up and treat the patients. So from that experience, I discussed with my family again, and we could set up nurse lab clinics for HIV regular follow-up. If there is problem, we discuss with doctor, but for regular follow-up, we could set up a program. So that was really helpful, I would say. And of course, from the conference, I have learned a lot of new techniques and publications, and that also contributed to the research and we're doing in Myanmar as well. So thank you. Thank you. Hope to see you.
Hi, my name's Alison, and I'm an HIV consultant in London. I volunteered through the Green Shoots Foundation in 2015 to work with Medical Action Myanmar, working in their 4 clinics, which they had at the time in the poorer townships surrounding Yangon. The mission was medical assistance and medical education, so the idea was that I could transfer some of my knowledge that I've learned through my specialist training in London to upskill local doctors through increased knowledge and help to develop their critical thinking and problem solving approach to patient care, so that they could, together we helped develop local guidelines, looked at local pathways and processes to improve the care that this vulnerable group of patients received when they attended the clinics in Yangon. The consultations were either general medical consultations in which screening was also offered for HIV testing. We'd look after patients with HIV and TB for long-term care. Antenatal care was offered, which included screening for infections like HIV. And through this, we were able to prevent mother-to-child transmission of HIV. There was also a significant amount of work with malnutrition and refeeding programs, particularly for infants, and a focus on family planning so that women could be empowered to choose when they had a family and how big that family was, and also work with malaria diagnosis and treatment. I feel privileged to have worked with this organization, and I strongly believe in the program and empowering local healthcare professionals through education to improve the quality of care that they are able to offer to such vulnerable populations, particularly when it's so difficult to deliver care to these groups. And I would strongly and wholeheartedly recommend their work. Thanks so much.
Jenny, specialist nurse in sexual health and reproductive health. I currently work at Homerton Hospital in London, and I spent time in Myanmar January 2017 for 6 months, and was working with Medical Action Myanmar. I was lucky to be supported and sent by Green Shoots at the time. My role while I was in Myanmar was to support the nurses, provide teaching that they would routinely get. So I provided teaching around HIV, family planning, infectious diseases, also just general kind of nurses what we call mandatory training here. So things just like life support, CPR, anaphylaxis, things like that. I also got involved in service management as well, so improving the service, looking at ways with the nurses that they could run services more effectively.
Yeah, great. So hope you enjoyed those few video messages that we had. As you can see that, having sent volunteers for the past 6-7 years, every year they go, they change some practice, they do something new. They also make sure that there is follow-up from what was previously being done and how they could carry on the efforts of other nurses or doctors that have been around. I was hoping that Ed would be on the call right about now and I could ask him a couple of questions, but perhaps Sanjay, if I can call on you, maybe you want to add something. You've been to the clinics, you've seen how the doctors work. Do you have anything to add?
Yes, thank you very much, Monize, and it's lovely to see all of you online today. Please excuse my my view. I'm in the office and I've got a window behind me, so you might not be able to see me very well. But I think the first thing to say is that it's been such an honor and a privilege to be working with Green Shoots on this aspect of their work. It has been amazing to be able to host scholars at the Royal Free Hospital and to be involved in the workshops in Myanmar. Amazing work that has been undertaken by everybody concerned to put these together. And I have to say the support from the Ministry of Health and the MAM clinics has been really fascinating in terms of getting the education out to those that are serving the population. I have not had much experience of working in the clinics apart from the times that we were there for the workshops, and it'd be nice to hear Ed's views on this, but the level of care provided by the clinics was second to none from the visits that we had in the clinics. So I think this has been an amazing piece of work, and I hope that the pandemic doesn't change this and that we're able to carry on in this regard in the very near future. Thank you very much.
Thanks, Sanjay. Ed's just dropped me a text that he is coming online, so I might pick his brains later on. But what I will do is I'll give you an overview of how MAM is operating during COVID. So MAM is the clinic that we work with, and they have 7 clinics around Myanmar and a few other remote health programs in villages. In the clinics, as you can see in this photograph, they are quite nicely ventilated because of the design anyway, but there are patients coming every day. They see about 250 patients per day. And during the clinics, they were operating a kind of screening at the start of the day. Every day, they would sort of screen the patients that came in, sort of separate them if they had fever or not. And Green Shoots did a lot of fundraising for them in terms of PPE equipment and making sure that they had the facilities to continue running, having sanitization equipment and all. So we were lucky to have been supported by organizations such as TraceLink with grants, but also smaller trusts and foundations. So the clinics are continuing to operate. And it would be kind of interesting to see how this unfolds during sort of political unrest that's taking place. Are vaccinations happening? I do know that there are certain online teaching sessions that are being recorded for the doctors and participants in the program for making sure that they stay up to date despite political unrest within Myanmar. So if you have any questions, please do put them in the chat and we will attend to them later on. But I think for now, what's best is we'll carry on so we can go on to our work in Vietnam. So I'll introduce this a little bit. We don't have anybody on the call from this program, unfortunately. But our work in Vietnam was just over a year in 2015. So it was the first year that I was full-time at Green Shoots. So the main thing that we did here was a workshop, so very similar to the formats that we follow in Kyrgyzstan and Myanmar. We had a workshop, but mostly for government professionals, so people that are in charge of policy writing for decentralized healthcare systems. So making sure that lower kind of tertiary healthcare units in smaller villages were equipped with healthcare services for people with HIV. And we worked specifically in the north, in Hoa Binh, which is a town, sort of town or kind of province that had a high number of HIV, people infected by HIV. And this was due to a vaccination program that was run earlier when they worked in mines. And so there was high infection rate. And the other thing that we did, which we are quite proud of, is the provision of loans to people living with HIV. So about 5 people were provided with kind of top-up loans from a previous UN program to allow them to set up their kind of businesses, mostly related to rural development. So farmers or chicken raising, pig raising. There's lots of videos on our YouTube channel, which document the stories of each individual that was provided with a loan. So feel free to go and follow those. And so now I will move on to our work in Kyrgyzstan. We have quite a nice participation of people from our partner there. So I will speak about them first. Our partner is the Kyrgyz Medical State Institute, and they are a university, but they're also attached with lots of clinics. They have a really high standard of teaching for sort of international students as well as locals, and they are kind of focusing a lot on infectious diseases with the help of the National Infection Control Center. So this organization is affiliated with the Ministry of Health, and they would regulate all the teaching. So it's nice to be partners with them when you're trying to work in HIV. And so in Kyrgyzstan, our achievement was a workshop which was conducted in 2014. It was, I think, a two-day workshop with a short number, 18 delegates, but everybody coming either from a decision-making level or doctors and nurses, doctors that could sort of take learning and introduce it to their clinics or hospitals. So we were hoping to have lots more kind of participation from Pavel, who's I think taken into clinics at the moment, but hopefully he might be able to join later, and he should be around for us to ask a few questions. Another achievement from Kyrgyzstan has been the fellowships, and we have both Svetlana and Anna on the call today, so hopefully they'll have some anecdotes to share with us later. But they came and were at the Royal Free Hospital for about 2 weeks each in 2017, if I'm correct. And they were taking part in day-to-day sort of activities within Royal Free. They were hosted by Sanjay, and Svetlana, who also works in pediatrics, was at the St. Mary's Hospital I think it's in Paddington. So they've also recorded a few messages for us. We'd like to listen to those. Hope the volume is okay. I better add that they made these videos themselves. So I think that's quite a special touch. That doesn't work. What? Great. So thank you for those. And as you can see, they both had quite a different experience. With Svetlana, we really catered it, so it was going towards her work in pediatrics. And then here's our impact so far. So it's quite a lot of numbers, but I think the main one to take away is that we've organized fellowships. We've organized fellowships for 13 doctors on Myanmar and Kyrgyzstan. So they've come, they've been here, they've been hosted by hospitals here. We've had medical educational workshops and volunteers that have gone and worked with patients and doctors in both in Myanmar. And it would be great to, so I think I can either pause now and give you a chance to ask us a few questions. And Dr. Wu gives his apologies as he has to leave. But Ed has joined the call, so perhaps he would like to give us a little bit of his kind of thoughts on our work in Myanmar. And we'd given a presentation earlier, and we thought you were somebody that's been involved in the work, especially as giving your time and being in the clinics for extended amounts of weeks. And so maybe you could give us an idea of what is the real change that you saw in that time, and how we could sort of improve on that. Wait, Ed, you're muted.
I was apologising for being late. I thought it was this afternoon. So you're lucky you caught me, because I've only just got back in the house. So, oh my golly. So you better know about me. I'm a retired physician. I'm an infectious diseases doctor, and I specialised in HIV and hepatitis and tropical medicine. And so I travelled quite a bit. And after I retired, which was some time ago now, I wanted to go somewhere. And I'd been to Myanmar a couple of times under the auspices of Green Shoots Foundation for one of their educational events. And the people that I met there, in particular Nini and Frank, were effusive about what they did. And I could see it was just a wonderful organisation. And I went to the main clinic, and when it comes to logistics and having a tight NGO, you could see that Frank and Nini had set up something which was incredible, and it was only progressing and it was expanding. And there's no doubt, because from the time that I arrived to the time we are now, they have expanded the number of clinics throughout the country. And also, the sort of doctors in the very rural areas. And when I say doctors, I mean trained sort of heads who've got some sort of medical knowledge. But I'll get back to the clinic. The staff in the clinic are wonderful. In the largest clinic, there are about 7 or 8 doctors, and they're not working all the time. We caught what was called affectionately the bus, which it took about 1.5 hours to get from the centre of Yangon to actually the clinics. And it was quite an exhausting ride, because I was the widest of all of them. Everyone else seemed to be so skinny. Anyhow, we arrived there, and how can I say, I don't know if anyone's described to you what actually the clinic is like. It's all of the clinics have some beds, and this being the biggest clinic, it has about 8 day beds, and patients can be brought in for 9 o'clock and they can go home at 5 o'clock. And patients that are seen there who are sort of inpatients or day patients have a host of conditions, and the majority of them are very severely sick. It's not the sort of conditions where in the West you would think of ever sending them home for about 2 weeks, but they come in with their cryptococcal meningitis or their TB meningitis, they have their drugs, they have their infusions, and then they get taken back by their relatives at 5 o'clock and brought in the following day. So that is an incredible service, and it works superbly well. But the majority of care is done as outpatients, and this runs from sort of pediatrics, includes gynae, sexual health, there's a big counselling service, but mainly sort of general medicine, and with about 5 or 6 doctors working in separate rooms. While there, a dedicated hepatitis service was developed, which ran fantastically well, as some specific antiviral hepatitis drugs were donated. There were HIV patients is a major problem, and TB patients are a major problem. The two big diseases are TB and HIV. Now, HIV, since the advent of viral load testing, which occurred in about 2017, has been transformed because given the structure and the organization of the clinic, and the way that patients adhere to their therapy through the follow-up, if patients don't come to clinic for their appointments, they are followed up, and they're literally brought back to clinic for their follow-up. And so there's a tremendous community team. You've got about 85% of people who've got what we call an undetectable viral load, which means that their HIV is completely controlled. And again, now, as soon as somebody is diagnosed as having HIV, they go on to treatment. So it's what's called test and treat in the business. And that means people don't get sick. They don't get all these horrible infections that patients with late stage HIV get. And so that's a transformation, but TB is a major issue.
Yeah.
And the concern, of course, is, and it has been shown in many other low middle income countries, is that with the problem that is happening at the moment, there will be interruption of services, there will be interruption of drug supplies, patients won't be coming to the clinic, there won't be the available community teams to go out because of the threats and the environment. And so you're going to end up with the virus rebounding in HIV, tuberculosis becoming resistant, HIV becoming resistant.
Ed, let me stop you there. Just let you know that in the first lockdown, Nini and Frank reported to us that they had all their services as normal going ahead.
Yeah.
They're meeting all their targets, and it's great. It's just,
it's not the COVID, it's
the political situation.
It's the military problem.
Which is now to see
1,500 HIV patients coming on board. Now you've had Nini, who's obviously got her feet on the ground there and knows all about it. And so I can only, she's already spoken, and it's not like that. But that is the fear, because you can't avoid having disruption of services. I would have thought that Nini would say that, that, however hard you try, patients are going to be scared to
yeah, I think that is the real fear now, and she's written to us about that as well. But just to manage time, and so
I've talked too long. I'm terribly sorry. You should have just.
No, it's not at all. I think what we had to hear, what you had to say, you've given, the situation inside out, and you've also been working in hospitals at the moment in the UK, so you understand how it is to treat people with COVID or with the virus.
Yeah.
So there is another question, and I think Sanjay has taken a stab at it. But basically, one of the questions is, what do you and attending participants feel about the future of healthcare in developing countries in the post-COVID future, and how Green Shoots will be able to help there? So I think maybe if I show everyone my next slide, which talks a lot about what's next, we might come to some form of idea. But yes, that's true. What is next? And so one of the things that Green Shoots is trying to work in, and John Mark, please do chip in, is digital health. As you saw from my presentation, a lot of the activities in our work, the main sort of key factor is flying. We would fly to do workshops, or we would go and fly our volunteers, or we would fly people over. And none of that really took place last year, which was a shame. But what it did was it gave us a lot of time to really sit and think of how do we reposition ourselves, and how can we still continue to help our partners and also make new partnerships. So digital health is something that we are thinking about. We would be quite keen to either work on phone apps to make sure that healthcare is provided still to the people that need it. There's a few people here on the call that I have talked to about this. And I think, yeah, making sure that, either it should be a product that our partners need. And it's great to have our friends from Kyrgyzstan here, because we could get their views on it. Is this something that they have thought about? But the end goal for Green Shoots has always been that it's going to be for patient care. So it has to be something that connects patients to healthcare settings, making sure that they are able to access the treatment that they need, be it for TB or HIV or both. I think once we have some form of skeleton of a phone app that's created, it can be customized and it can be tailored for the people for different illnesses. So that's definitely something that's on the cards for us. And I think, yeah, that's all from me. But I think what we haven't had a chance to speak to our partners in Kyrgyzstan at all. We haven't heard from them as yet. So I'd either ask Turinisa or someone to give us a little idea of impact of COVID in Kyrgyzstan. How has your academy sort of functioned, and what are the main goals?
Hello, everyone. Congratulations on the 10th anniversary of Green Shoots. So our academy moved for online platform. So students are still studying in remote. And about COVID impact in Kyrgyzstan, overall, our specialists, Anara and Svetlana, will share. So from my side, I was just typing the question. We are moving, as many other universities, towards the internationalization. Of course, we want to increase the potential of our students and staff. So we definitely want to continue our collaboration with Green Shoots, and we want more mobilities of our specialists in such programs as MAME. So, as you know, the English is not our native language, and this is the one of the huge problem. And I would like to ask, can Green Shoots help us, assist us to maybe to arrange English proficiency courses? Maybe that will be digital courses online.
Because I know that a lot of your student intake is actually international. There's a large proportion.
Yes. There are a lot of international students. Yes, so they are studying in English here. Most of them are coming from India, Pakistan, but we have local students as well. More than 5,000 students.
And right now, everybody is online.
Everybody is online.
Okay. And
if you allow me to interrupt, just turning the clocks back in time. So in 2014, we had the first workshop delivered in Bishkek, Kyrgyzstan. And we had the opportunity there to have two fantastic doctors with us. Jürgen, who was treated like a superstar, and had his books being autographed by local doctors. And of course, we had the amazing chance of having Pavel with us, who has just joined the Zoom, and Pavel delivered his bits of the workshop in Russian, which I think was deeply helpful for the local doctors who attended that first workshop. So maybe Pavel, I don't know if you want to step in.
Hi, Myanmar. Hey everybody! So it was a really great pleasure to participate this workshop for a few years already, and it's so of course it's sometimes easier for doctors if we do presentation in Russian, and it's also it's great pleasure for me was to be part of this mission, and of course if we have next idea I will be ready. After COVID, but also some other things like Zoom meetings. So we have a lot of experience right now with in different virtual meetings as also suitable, I think, for the situation in Kyrgyzstan. So we don't need obviously to go there. It will be my pleasure to go there, but it's otherwise we could do it something on Zoom. So we could generate some idea if in Kyrgyzstan doctors need special support. Sure.
That's great. Thank you. Svetlana has raised her hand, so I allow her to ask her question. She might have to unmute herself. Yeah.
Good afternoon. I'm very glad to see you today. Jane, Mark Debrion, Munizai, Dr. Sanjay, I'm very glad to see you today. I would like to congratulate Green Shoot on their anniversary today. And I want to wish you success in your work. Your work helps doctors around the world to acquire a new knowledge. Of course, it's a very great program. And I hope we can take some information from your program again. And today I have some questions for you, if it's possible.
Please.
We have, today, of course, we have a pandemic in the world. It's a very great problem in the world, not only in Kyrgyzstan. And of course, we have problem with information sometimes. And I would like to ask you maybe to take in our university some lectures, maybe if it's possible, if you can read, teach some lectures about COVID infection, maybe HIV infection. We have very little information about HIV infection among child. It's a problem too. We are not only doctor, we are teacher. And we teach medical students not only on Russia, on English language too. And if we can have a lot of information about HIV in the pediatrics, a lot of information about COVID in pediatrics, it will be very great, very good for us. And we have one problem else. There are many very qualified teachers in our university, but we can't visit to any interesting hospital like Real Free Hospital, maybe Santa Maria Hospital. And if it's possible, you can invite maybe some of our teachers in your program, involved a lot of our teachers in your program. After your program, we have a lot of information, and we can give this information not only among our colleagues. We can describe this information among young doctors, among students, medical students. And after your main program, we have a lot of changes in our program when we study our students. And we will be very glad to have more information. Maybe it's online lecture. Maybe you can visit our country after pandemic. Yeah, we will be very glad to see you in our country, in our sunny Kyrgyzstan.
Yeah.
And one question else, if we could organize maybe online course of language for our teacher with medical experience. Yeah? In our country, we have a lot of courses of language, English language, but not there are little the minimal course when we can take information about medical terms, medical information on English.
Okay.
But if you could to plan maybe in future course online, it's will be fantastic. Thank you so much.
Thank you. No, thank you, Svetlana, for it was really nice to see you after a few years. I still remember the time that you were here in London and you stayed in my house. That was fun. So yeah, I think it's true. Something about online lectures is something I have discussed with Turinita in the past, and it would be something that could be pre-recorded and shared, and that's very easy to do, and that is something we would think about it. This was also the first time that we had a chance to bring our two projects together and share it with everyone. So the fact that, you know, we do placements in Myanmar is also something that we can do in Kyrgyzstan. So we can also send volunteers who can work in clinics and perhaps assist with teaching, is hopefully something that we can do post-COVID. But I think for now, most things we're looking at are more for digital intervention. And that is something that, you know, you and I can discuss between me and Turinisa. And Pavel, thanks again. It's the first time I'm meeting you. I wasn't part of Green Shoots when you went on those workshops. So it's nice to connect with you. And I think we've discussed a lot in the past about telemedicine and how to do these lectures. So we could touch on them. John Mark, do you have anything to add? We're sort of at the last 10 minutes, so we can.
Yeah, I mean, maybe if you allow me, I'd like to answer some questions that nobody here asked, because obviously you all know already about it. Okay. But this is why basically did we become active in medical assistance, medical training, and in countries like Myanmar, Vietnam, or Kyrgyzstan. And the answer to that is, you know, we go back to the kind of holistic approach of Green Shoots, tackling the fight against poverty. Is if you have people with very low income, they are more, as you know, as we said yesterday, they are more exposed to illnesses, diseases, and the poor health actually will impact their capacity to provide food and good standards of living conditions to their households. So, you know, everything is linked, and this is why we looked at how we could bring in programs that would address that. Now, where would we operate? What was needed? Who could we work with? These were all questions that we had in mind, and especially given our limited resources. And this is why we adopted the kind of train the trainers approach. Okay, so train the trainers approach, we saw it as the most effective for an organization that lacked kind of financial resources, but had amazing opportunities to tap on the generosity of our doctors. And you have Sanjay here, you have Ed here, you have had video interventions of other of our doctors and nurses. Their knowledge and their time are what is the most precious. It's more precious than money itself. The volunteering, so the workshops, the delivery of workshops to train local doctors and nurses was very important. The volunteering of doctors, nurses, and pharmacists, as Munize mentioned, is also important, because that can continue the work with designated partners for during the rest of the year. And finally, the training of doctors from Kyrgyzstan, Myanmar, or Vietnam, bringing them to London to the Royal Free Hospital, for instance, is also essential because it opens up really their horizons, their networks, and send them back home with lots of ideas and enthusiasm. And for us, they become the best ambassadors we could hope for. So this is very important. And you know, as Lindsay mentioned with this slide that is still on, digital solutions are key to how we're going to address the issues going forward. They are important for us at Green Shoots, first because of course there's the COVID constraints and the travel restrictions that are quite big issues for us. And then second, because the digitalization is the way forward to make the most out of limited resources. So, you know, we really welcome all the suggestions that you made because they are important, and you know, we'll keep them into account when we work on the next delivery of programs.
Thank you for that sort of summarization. And yes, it's true. I think digital health solutions would be, you know, one way that we would like to add to the diagram that I showed you in the beginning, where we talk about these tools for our programs. So we're not looking to replace anything, we're looking to add. And this would go in line with our workshops, fellowships, and those can be done when possible. And I think it's great to sort of get so much more feedback from our partners in Kyrgyzstan about their needs and how they've been coping, and how the clinics are being run over there and also in Myanmar. But I think one of the, it's Myanmar is a specific situation where political unrest is taking more of a toll than just COVID. And I think it's a bit of a wait and see of how things unfold and how our partners are able to cope and how we can continue to support them. So we have sort of 6 minutes left. So maybe we can take more questions, or have, you know, one of our workshop participants, Ed or Sanjay, share a best memory from the workshops. Perhaps that would be quite nice to end this session. I certainly have a few which involve Ed getting stitches, but that's not a best memory, that's more of a worst memory every time we'd walk into those tiny airplanes.
Yeah, if I may, Bariz, I have to say an endearing memory for me was flying from Yangon to Mandalay in a propeller aircraft that, yes, was quite an experience, I have to say. And stopping somewhere in the middle where people just got on and got off. It was really fascinating. To get back to something serious for just a couple of minutes,
yes,
the impact of COVID. I have to say one thing that SARS-CoV-2 has shown us is that viruses don't respect borders. In other words, you know, when infections happen, they happen across the globe. And I think what this will do in the end is tell us that we need to strengthen all healthcare systems to keep the globe safe. So nobody in the UK or Europe or the United States is safe until everybody around the world is safe. And so I think there will be, and it's already beginning to happen, that there will be more investment in strengthening healthcare systems around the world. And so I suspect that organizations like ours are going to become really important in terms of delivering this strengthening of healthcare systems. I think people have mentioned this along the way, but I think digital delivery of programs is going to become hugely important because, you know, apart from the fact that traveling is inconvenient, you know, people are beginning to think about their carbon footprints as well. And so I think there are many things that will change as a result of COVID, but I think as I said, there'll be many pluses, and I think there'll be huge amounts of investment in strengthening healthcare systems around the world. Thanks.
Thank you, Sanjay. Ed, do you have anything to add?
Well, about that, yeah, I think it has to start with getting vaccines, you know, from the high-income countries all over the world where it's needed, because they'll never be protected until the rest of the world is protected. The variants are going to arise, and they're going to then, the whole thing will have to be redone in the West. So it's a good example of investing in the low middle income countries so you can protect the West, if nothing else. But of course, I agree with Sanjay. I always agree with Sanjay.
That's how the workshops went smoothly, because we just had to agree with.
Yeah, well, I mean, the workshops were fantastic. I mean, my memory of the workshop is that I learned, when I was out there, how to make them go a little bit better. And certainly we had breakout rooms with, a sort of expert panel and case histories being shown. And that gave a chance for local doctors to showcase their talents, and that was important for them, and improve their English. So there were lots of things. Those conferences sort of brought the thing to a head, and there were highlights. Apart from the episodes of, well, I've learned one thing I do remember is my trip up north to Padawa. I had made the mistake of going to my local wonderful restaurant and getting the most awful Burma belly, which hit me just as I was boarding the plane. And I spent most of the week stuck inside in bed, rehydrating. And I thought I was going to die, because I remember asking one of the local doctors, I said, don't you think I need to get some intravenous fluid? And they said, well, there's nobody but you up here. So, this is some time ago. So I thought, right, but it's happened, like they always do. But the experience of actually being there and volunteering was, it's not just laudable, it was a wonderful experience for me, and I learned so much. And I think for anyone who's considering volunteering, when you can, it doesn't matter which country you're going to volunteer in, I think that there are so many benefits to learn about people, about cultures, and about medicine that one would never regret it. That's it. That's not a memory. That's another diatribe.
It's a diatribe that we like, Ed.
Yeah.
If you allow me to add just one more thing here, because Muniza and I, we are obviously not doctors, okay? And at our advanced age, especially mine, I don't think there's any hope for me to become a doctor one day. But I think what COVID actually taught us is something that we both knew already for a long time, being associated with you guys, is how wonderful human beings doctors are. And we have you guys here in the UK donating your time, your knowledge generously. We've got our fellow doctors in Myanmar, in Kyrgyzstan. We have Pavel in Germany. Doctors in so many different countries who are looking after their fellow human beings and providing care in the remarkable way that they can. And through these workshops and these volunteering programs, you have also associated, I guess, what are the two best professions ever, doctor and teacher. It kind of took us a global pandemic, I think, in the West, to appreciate how important doctors and teachers are to the rest of society. And I hope that we will remember that in the years to come, and that we will look after you guys, because you are definitely looking after us. And that's for me. So a big thank you.
Thank you. Great. So I think that's where we sort of end the hour. Otherwise, we'll probably go on and on talking about our experiences and time in Myanmar. But really, one of the things that I would like to take away from this is the plan forward. And I think it's an exciting sort of stepping stone at 10 years. what's next. And one of them is digital health. And I'm glad that, you know, we have interest from our partners in this. And when they're ready, it's something that we can do with them. It's a little tricky right now to have some solution like this in Myanmar, because the one thing that they don't have, which is reliable, is access to Wi-Fi and digital. And that's a real shame, because that's going to put another it's going to be another setback. But hopefully, you know, one thing out of today's call will be a discussion with our partners in Kyrgyzstan on developing this and then making a new way forward. So I do thank everyone for their time. If there are more questions that come up or things that you forgot to mention, you can always email me. I love receiving emails from all of you. But other than that, thank you for today. Okay, bye-bye.
Thank you.
Yeah.